Hey everyone, so now we'll be starting with part 9. So we'll be starting with local anesthetics. So in local anesthetics, we have two categories, amides and esters. So in amides, we'll have everything that has two eyes basically, and here we'll be having only one eye. Here we'll be having two eyes like bupivacaine. Then we have lidocaine, prelocaine, and ropivacaine. Here we have cocaine, benzocaine, and procaine. So these are examples. Now coming to metabolism, so they are metabolized in liver by cytochrome 450, and these will be metabolized in plasma by pseudocholinesterase, and these are longer acting agents, and they cause less allergies. These are shorter acting agents and more allergies. So why? Because of PABA metabolite. PABA metabolite. So these are the basic differences between amides and esters. And coming to next part, that is eutectic mixture. So basically eutectic mixture is mixture of lignocaine plus prelocaine. So 25 grams or 2.5% concentration is present. Next we'll have Bayer's block or intravenous regional anesthesia. So where person's hand will be there, we'll be putting pressure, build up a pressure, then cotton pad, and we'll give this lidocaine. So this is contraindicated with bupivacaine and sickle cell anemia because of risk of microvascular occlusion. So this has to be a contraindication. Now we'll have few facts which we have to remember about local anesthesia topic. So let's see them. Coming to the facts. So first of all, mechanism of action. So unionized form is there which will be entering into the neurons, and then there will be inhibition of sodium inhibition is seen. So therefore we can also say that sodium bicarbonate will actually enhance action of local anesthetics because there is also sodium here, so it will be enhancing the action. Now autonomic greater than sensory greater than motor. So this is basically effect on different types of neurons, and so we'll have some memorizing points here. So hypertension causing anesthetic will be cocaine. Then we have most cardiotoxic, that is bupivacaine. So dose is 2 mg per kg. Then we have side effects of like methemoglobin with local anesthetics like prelocaine and benzocaine. So benzocaine is actually used in oral surgeries or dental surgeries. And we have max dose of lignocaine, which is 5 mg per kg, and epinephrine. With epinephrine we can give 7 mg per kg dosage. And coming to proparacaine action, it has 10 to 20 minutes of action. We can see proparacaine. Then safest in malignant hyperthermia will be procaine, and CNS CVS toxicity is seen with local anesthetics. And route that is safer will include IV, intratracheal, intercostal, then caudal or epidural, and finally brachial. So this is what you have to remember about local anesthetics. Okay, now we'll be starting with opioids. So in opioids, we have full agonist, then we have partial agonist, and we have mixed agonist, and we have antagonist. So first, easiest one, antagonist. As we know, it is naltrexone and naloxone. And coming to full agonist, partial, and mixed. So full, heroin, then we have morphine, pethidine, meperidine, methadone, codeine, then fentanyl. Coming to partial, we have only one, that is buprenorphine. And in mixed we have pentazocine, we have buterphenol, and we have nalbuphine. So these are the examples you have to remember. Now coming to memorizing points, we have to know. Before that, I just want to make it clear that with pethidine, so usually we have 99% of pethidinic acid as byproduct, but however 1% can become norpethidine, and this will accumulate in the CNS. It gets accumulated and this can cause seizures. So this is something I want you to understand. Now, yeah, so coming to those memorizing points which we have to know about opioids. So avoid opioids if there is a recent head trauma or injury, if there is biliary obstruction or colic, if there is asthma, if there is sphincter of body dysfunction, and mydriasis is seen with meperidine, and pruritus is one common side effect that is seen with these things. So there will be release of histamine which will cause vasodilation and hypotension. Now we have no tolerance to meiosis and constipation. There is no tolerance. And serotonin syndrome. So what is serotonin syndrome? It is basically SSRI or SNRI plus tramadol. And wooden chest syndrome is seen with fentanyl. Prolonged QT is seen with methadone. So just remember, this is QT is methadone, and this one mydriasis is meperidine. And shortest acting which is used in daycare is remifentanil. So this is important, and remember, you have to remember this. So with this we have finished part 9 and we'll be starting part 10 now.